Hi, I'm Dr. Kylie Snook and I work here at the Mater Hospital. I'm a breast surgeon. October is Breast Cancer Awareness Month, and I think it's a really important time to stop and reflect on how breast cancer impacts on our lives. We know that up to 1 in 7 women in our area will be diagnosed with breast cancer by the time they are 85. So it does affect a lot of our population. Having said that, it's not just a female disease, because 1 in 100 people who get diagnosed with breast cancer will actually be male. The most common presentation for breast cancer is with a lump, but that's not the only way breast cancer can present. Some women might just notice a dimple. Women might notice that their nipple starts to move in. Others might notice a discharge or even some skin discoloration. It's important to know that if you notice a change, you need to go and see your doctor. By far and away, the 2 biggest risk factors of breast cancer are being female and getting older. And most of us can't change those 2. So what are the other risks? Drinking a lot of alcohol, putting on a lot of weight, not exercising as much. So they're things that you can do to try and reduce your risk of breast cancer. We also know that our really good socioeconomic lifestyle here can be associated with breast cancer. Using hormone replacement in the dual form for long periods of time can also give you a slightly increased risk of breast cancer. Over the last few months, because of the COVID pandemic, our breast screen services have been closed because our staff have been deployed to other areas to help with the pandemic. It's really important though, if you are due for a screening mammogram, to still have that mammogram if you can. You can see your local doctor and ask for a referral, or as the screening program opens up again, they'll be calling you back to have that screen. Make sure you do it, because we do know that cancer doesn't wait for a pandemic, and if there is a problem there, we do want to get onto it early. At the age of 74, the reminders to come back to breast screen will stop. But just because you're over 74 doesn't mean you can't get breast cancer or that it won't happen. Some of my oldest patients to get breast cancer are 101. So it's really important, if you're well and you're over the age of 70, to still continue having screening mammography. And your GP or your specialist will guide you as to how often you should do that. Generally speaking, every 2 years.